like the nerve is visible about 5 millimeters.
Hey guys, I show a lot of wisdom teeth extraction videos, like over 500 on my YouTube and Instagram and stuff. You know, the step-by-step stuff on wisdom teeth. This study in particular, it's called the Radiographic Predictors of Postoperative Inferior Alveolar Injury and Mandibular Third Molar Surgery. And this is from the January 2025 Journal of Oral Maxillofacial Surgery. So, and the purpose of this study was to compare radiographic findings on Panerex versus cone beam CT and their association with a postoperative nerve injury or paresthesia. They're asking the question, is a Panerex good enough, or does the cone beam CT add more value, and does it reduce the incidence of postoperative paresthesia? And what they found is that it doesn't. The Panerex is fine. The CT doesn't really change anything. So that's interesting. In 2016, NIST put out the white paper, and at that time in 2016, they said that more research was needed on cone beams, and that makes sense. In 2019, the European guidelines said that CPCT didn't improve postoperative outcomes, so Panerex was just fine as well. So what did this study find? There's three main things that predictably have been found to increase the chance of postoperative paresthesia or nerve injury after wisdom teeth removal. Number one, darkening of the root. Number two, narrowing of the canal. And number three, diversion of the canal. So those three things have been found over time and also in this study that have the most effect on postoperative paresthesia. So if you're going to take a wisdom tooth out and you see the root's darker or the canal's narrow or the canal changes direction a little bit, then those are riskier. Okay, so that's what I'm trying to say. I know there's other predictive things out there, but those are the big three. And what they found was diversion of the canal is the most predictive in postoperative paresthesia. So what they found in this study was, out of those three, that diversion of the canal. So if the canal changes course, the root of the tooth pushes down, and you see on your film, a two-dimensional film, that the nerve moves a little bit around the root, that's the worst. You know, you have a higher chance of getting a post-op paresthesia in this study. And they attribute to possibly when the canal has to change course, maybe the top of the canal doesn't have that cortication or that denser cortical bone protecting it. But that's what they found in this study. And I'll put up this graphic here. So what they're saying here is these wisdom teeth roots that were 2 millimeters and above the nerve canal were safe generally. If they were less than 2 millimeters from the nerve canal, that was an issue. Obviously, if they were below the nerve canal, that was the worst case scenario for nerve issues. If you did get a CT scan and you see that the nerve is on the buccal or the cheek side of the root, that's a little bit more likely to get a nerve issue. If the nerve was on the tongue side or lingual, that's the safest. If the nerve was directly under the root, that's the worst. You take a tooth out and now the patient has some numbness in their lip or chin. What do you do? Or what if you think that might happen because the nerve looks close on an x-ray? Do you do anything before or during or after surgery to help with that? Is there something that you can do that's, over the counter even to help with that? And is there any validity to that? And there actually is. The three that we're going to talk about today are basically alpha lipoic acid. The other one is glutamine or L-glutamine. And just a B complex. Memorial Sloan Kettering Hospital is one of the premier cancer centers in the world, right? If you go to their page and you search, vitamins, supplements, and things, they have a whole separate area where you can look up pretty much any herb, and they'll tell you, hey, this is helpful for this sort of treatment and this sort of treatment, and obviously it's coming from a pretty reputable place, so it's a nice place to go rather than just some rando site on the internet. And they found that it's a powerful antioxidant, which we knew. but this study found that it significantly decreases the incidence of depression and peripheral neuropathy. So the other one is glutamine. So typically L-glutamine, 10 to 30 milligrams per day. Up to date says 500 milligrams a day is fine. For neuropathy, it does require a higher dose, so you can dose it easier as a powder that way if you're going for the higher dose regimen. You're going to find some studies with glutamine, and this one's saying it's for the treatment of incretin-induced neuropathy in children and adolescents with cancer. It's well tolerated and improvements in sensory function and overall quality of life. And you can use it to treat weakness and loss of muscle mass, treat neuropathy, which is the numbness and tinglings in the hands and the feet and so forth, and things like that. Bonus effect, it can help your recovery after surgery by reducing your risk of infection, which is cool. The other one is B complex. And I say B complex because you're using a few of the B's in there. Might as well just get the complex. It's just easier to dose. And this study found that it significantly improved symptoms of alcoholic polyneuropathies. I'll prescribe these 3 things, and it's really not even a prescription. It's, hey, I write them down. Hey, get these. Get them. You can get them from Amazon, or if you go directly to FullScript or other places, or you get them directly from Thorne or places that sell legitimately, that's probably safer. And I see them a month later, like 30 days later, and I retest their sensory deficit and to make sure they've been on those. If you do enough of these surgeries, you're going to see this stuff. Trust me. I mean, everything's going to happen, right? These are sensory deficits likely from the nerve just being really close. So I hope that's helpful. If you have any questions, let me know.